Dr. Martinez, I know that you deal with children. In fact, you did. You gave us some really good information about how moms handle children and when they should come in and what. What about sealants? Are sealants a good preventive thing on an average? Are they needed for everybody? Is it only for people with their first teeth or their second teeth? Is it also for adults? Just tell us everything you know about sealants, which I'm sure is everything.
Well, I don't know if I know everything about sealants, but I have done a good number of them over the years. Actually, I used to be a hygienist, and as a hygienist, that was one of the procedures I did very commonly on children. I did it on some adults. I've done it on some adults. But for the most part, I would say is for children that have their first molars erupting into the oral cavity. Usually that's about at 5.5 to 6 years old, when the grooves are very, very nicely formed, and that's when the children have the least bit of articulation to brush their teeth, and they can't get that toothbrush in there. And even if you could get the toothbrush in there, the bristles are too big for these crevices. So it is a very, very nice tool, if done correctly, that seals these little crevices just as they're coming into the oral cavity, so that it prevents the bacteria or anything sticky or anything from sitting on these molars and creating a cavity. And so it is a very, very nice preventative tool that we have to use. It's kind of difficult sometimes because people can't understand, parents sometimes can't understand that little Johnny has to get a filling done, because essentially it is a filling. We can do air abrasion to open up the little grooves a little bit and then seal them completely, because sometimes these crevices they're microscopic. Not sometimes, they are microscopic, and so it is very, very nice so that we are able to get some sealant into these grooves completely, and so that bacteria doesn't seep in there. And so it's a very great tool that we have.
How long do they usually last? Like, when you put them on, do they have to be redone every year, or never really, because they last the life?
No. They usually last about 2 years, and it really all depends on the treatment that and the care given. Because it's like with any restoration, any filling, any sealant, anything in the mouth, if you leave bacteria on it for any length of time, it'll break it down. So it really is also dependent on how well the kids and moms are helping take care of the teeth. But it's actually just given that extra coating that if you didn't have, for sure you would have that cavity. So that sealant, it's kind of like a little, I tell the kids, it's like nail polish over your teeth, because usually it's clear, or it could be tooth colored. So to just cover the teeth and give you that extra protection. It could last a year and a half, 2 years, and it really is dependent on care given as well. So,
okay.
And when we see a child, we like to see them every 6 months. But that's one of the reasons we like to see them, to make sure that we are monitoring that there is no breaking down of the sealant, that all the grooves are still sealed, because otherwise, if it's breaking down, we can actually get decay in these grooves, and that's what we're trying to prevent. So it's very, very important that if done properly, if done correctly, and that maintained at home and with regular cleanings, we are keeping an eye on them, they should be fine. These kids grow up without cavities for many, many years. I'll give you an example with my own children. I did it on my, she's 6 years old, and I actually did it as soon as she started getting her permanent molars. And I actually did it on some baby teeth as well, because just to cover these grooves. It doesn't hurt it, and this way prevents cavities. So why not?
And it is important, I guess, to maintain the baby teeth as good and as long as possible. Number one, whether a baby tooth hurts or a real tooth hurts, I guess to the child it will be hurting, so you don't want that to happen. There's no reason to fiddle around with a drill in a child's mouth if you don't have to. And at the same token, the tooth, by structure, the way we're growing, is meant to stay there for a certain amount of time. So if it comes out, then I have heard that many dentists say if the baby tooths are not maintained, they should be for as long as they should be, whatever that is, then you risk that normal teeth come out very crowded, and you spend thousands of dollars and years of trying to straighten them out with orthodontic, which you're doing, but again, preventive care starts right there and then to not necessarily for surely eliminate, but to for surely to have a heck of a chance of not making the orthodontic bill as big and as long as it otherwise would be. Is there some truth to that?
Sure. I'm an advocate of preventative dentistry. Anytime you can do preventative dentistry, it is cheaper, it is less time consuming, and most of all, it does not hurt. So if we can prevent all these problems in a child starting at 5.5 to 6 years old and have a child that grows up cavity free and hasn't really experienced pain, you're going to have a great patient for the rest of your life. You're going to have great teeth and a great patient. That you have prevented the loss of baby teeth. You were right in mentioning these teeth have to be in there for a certain amount of time to hold a space for the child to be able to chew, and most of all to be pain free. And so if we can hold on to these teeth healthy teeth for the time that they're needed, then everything should fall into place for the most part. So yes, preventative dentistry is the most important thing.
And sealants fall under that category.
Of course.
Well, all right. Here you have it. Thanks a lot, Dr. Martinez.